Hello, hi, this is Dr. Erica again. Thank you for joining me for this particular video. I'm going to just briefly mention progesterone and estrogen effects and what they are used for and the different routes at which they are administered, or formulations, I should say. That's going to be your topicals, your sprays, your pads, your patches, and your creams. Also, not only topical, but inserts such as your suppository, your capsules and tablets that are suppository, your rings that are suppository as well, and then also your orals, your oral tablets that are taken. And these oral tablets are more so going to cause cancers. This route is going to lead to most likely with long-term use, greater than 10 years of use can cause ovarian cancer. So do be aware of these side effects. I made mention in my other video about these side effects. I'm going to say it again in this particular video, that the oral routes of estrogens over a period of 5 to 10 years can cause ovarian cancer. So do be aware of the different types of cancers. Endometrial cancer, breast cancer as well can be caused. Also, blood clotting can be caused by taking these oral tablets of estrogen and progesterones, mainly estrogen tablets that contain progesterone tablets as well. And those are going to be your oral contraceptives and your hormone replacement therapies for your menopausal and your perimenopausal females. Also, be aware that some other formulations, such as your suppository, your tablets and creams that are used for inserts, those are going to be more used for vaginal dryness, vaginal atrophy, which means that there's dryness, there's less lubrication, and so we're going to advise that patients utilize estrogen replacement, hormone replacement therapy vaginally so that it will work locally for the best effect. Okay, now do be aware you can take oral medications for the same effects, but because we want to deal with local effect, we want to apply a local medication. Now, the oral medications are also the tablets and so forth. Also are good for night sweats, vasomotor symptoms such as your night sweats and your not only night sweats, but dealing with the changes in mood, changes in a daily mood, and so forth. We want night sweats, sleep apnea, things like that. We want to give tablet forms at this particular point so that it'll work systemically to help. Okay, and then also be aware that progesterone is a medication, hormonal medication that is used with estrogen for those women who still have an intact uterus to prevent endometrial hyperplasia or endometrial cancer. So when the progesterone is given with the estrogen, this will help reduce the risk of endometrial cancer. Okay, so progesterone comes in 4 different classes or generations: generation 1, generation 2, 3, and 4. Now, the stronger the strength, or the higher the generation, the less we see in spotting and bleeding. But we're going to see side effects such as thrombosis or blood clotting as we get higher in the generations, such as, for example, with your drospirenone. Drospirenone is a 4th generational progesterone, and when it's given, it does cause that, rarely, but it is known to cause blood clotting. Again, we're going to see less of the facial and acne and increased cholesterol, but we're going to see, again, thrombosis or blood clotting. First generation, we're going to see more spotting and bleeding, and then we're going to see second generation, less spotting, less bleeding, but we're going to see more cholesterol increase. We're going to see more facial hair and acne increase as well. So do be aware of that when dealing with the progesterones. Progesterones are usually given in combination with estrogen, again, as an oral contraceptive. And then we also see it used alone for family planning, such as your Plan B products. Now, when you see it used alone, it's usually going to cause increased bleeding, and we're going to see a bleeding effect. So that's that is why we're going to use progesterone alone. And also, progesterone alone can be used in those who have recently given birth and are breastfeeding. This will help to regulate the female cycle while breastfeeding, and also get the hormones back in check for that feeding mother. Okay, so do be aware of that. So that's all that I wanted to mention for this particular video. I have 2 other videos recently posted: hormonal therapy and also progesterone effects based upon strength and generational class. And then this particular video is also a part of that series. So do be in the know about the changes in hormonal therapy and so forth. Thank you for joining me. I'm Dr. Erica. I hope to see you on the next video. Please like, share, and subscribe. See you next time. Take care. Bye-bye.